Friends, colleagues, today I want to tell you about one of the most important nerves in our body. This is the vagus nerve. It belongs to the so-called cranial nerves, meaning those that go directly from the brain, which speaks to their extremely high importance. Now, this is the largest of the cranial nerves. Let's go over a bit of theory. I'll be simplifying things a lot, but still. We have a nervous system that is responsible for our conscious actions. What we do, where we look, what thoughts we think. But there is also the autonomic nervous system, which, while we are busy with our own affairs, keeps us breathing, keeps our bodies warm, manages our digestion, and regulates our blood pressure. All of this is the autonomic nervous system. And the most important nerve of the autonomic nervous system is the vagus nerve. It simultaneously controls our heartbeat and manages all of our digestion. It controls speech and has a huge number of functions, even to the point that it can participate in the formation of the female orgasm. If, for example, a woman has a spinal cord injury in the neck area for some reason, then unlike a man, she can still experience orgasm thanks to the vagus nerve. In short, friends, this thing is extremely important. And if you have a variety of symptoms, sometimes with your intestines, sometimes with your heart, sometimes panic attacks, sometimes blood pressure issues, sometimes problems with thermoregulation, and it's unclear where it's coming from, then most likely it's a problem with the vagus nerve. It has more than 7 points where it can get pinched, and we are going to work with one of those points at the exit from the skull. And I will give you an exercise. This is a completely standard exercise. And we will also work along its pathway. It exits right here at the base of the skull and goes down along the lateral surface of the neck, and then it enters the chest cavity and continues all the way to the diaphragm, after which it splits like scissors. And heartburn too, that's also part of its story. In short, it's a comprehensive story with the vagus nerve. We will work with the base of the skull and with this part right here. I recommend you do this exercise every morning and every evening. It's especially important to do it in the evening, because this will ensure you have a significantly better quality of sleep. Lie down on your back. Look, you take your hands and place them under the back of your head so that your neck and the base of your skull are kind of in a hammock. Is that comfortable? Raise your hands in such a way that when you turn your eyes to the left or right, you can see your elbow. Your task is to make sure you don't turn your head. This is extremely important. You can spread your elbows a little wider if you like. Can you see your elbow? It's incredibly important that you feel completely comfortable in your shoulder blades and collarbones, friends. If you're doing this not just for fun, but to really feel good in your body, then you truly need to take it quite seriously. You can even put some cushions underneath to make it more comfortable for your elbows. Now look, turn to one side. Excellent. And to the other side. Excellent. Now pay attention. When you turn to the right, your head shifts slightly. First and foremost, keep in mind that your head should never move. So turn your eyes steadily toward the left and maintain that specific posture. Pay close attention to the fact that at this very moment, you have quite naturally and involuntarily held your breath. Keep your elbow within your field of vision. Continue this until you either take a deep breath, yawn, swallow, or sometimes you might feel a physical convulsion pass through your body. That's it. And that's completely normal, yes, pay attention to that. The body stopped breathing on its own and then it spontaneously inhaled. It didn't ask you. That's the function of meditative nervousness. And now to the other side. There, don't turn your head, don't turn your head. And here, notice, it's more difficult to hold. So how is it? Something happened, but it's not clear what happened. But something happened. Maybe I'm just imagining it. Some kind of profoundly deep calm spread inside. First, a distinct sense of bliss.
Relaxation.
Yeah. Sit down. Let's continue. This practice, this exercise really works when you do it more or less regularly. Because the various shifts and changes in the autonomic nervous system are not instantaneous, but they affect the very core and fundamental qualities of our life. The next movement, be extremely attentive in order to perform it. It will concern the nerve exits the skull. And now we've just put the cervical vertebra back in place. Some people will notice right during the process that something either pops or even clicks slightly. Lift it up. With this kind of eye movement, they put the atlas, the top cervical vertebra, back in place. And now I'll also show you an effective exercise that will release the vagus nerve, which runs inside the lungs and often gets stuck and adheres between the layers there. And now not only will we release it, but we'll also feel it. To start, look, you have the back midline of your neck right here, not the back of your head. Imagine that you're gently reaching backward with the back of your head like this. Not too much, not too much. Just slightly, as if you were a rider. Gently stretch the back of your head, then slightly turn your head to the side, just like this. And now from right here, stretching from this spot, pull your head back. Don't force it. Just tilt it back slightly like this. See, right here you can feel some structure being stretched. Take a slow, gentle breath in and then let it go. Feels nice. Let's do the other side. Look, straighten your neck just a little bit and keep it straight. You're so proud. Look at you, so proud. Now humble. Turn your head. And now just a little as if you're pulling away. And here is the most important part, the coolest thing you will see, that you won't succeed if you don't do this. If you make very, very small movements, you can truly begin to feel the sensation. If you move around too much, that sensation disappears. But if it's just a little bit, it seems to me that this is some kind of puzzled pose. Something like that. What do you mean like that? Yeah, right. Write and suggest in the comments what you would call this pose, and write down whether you felt a profound and intense sensation of tension right behind your sternum. By no means should you throw your head back, because that's a completely different thing and not very beneficial. Friends, it's strange to record this message because in my native language, Russian, I have about 2.5 million subscribers. These are people who are genuinely interested in the human body, in how, with the help of hands and simple breathing and meditative techniques, you can bring the body to its best possible state. I see how much the knowledge I share helps Russian-speaking people, and it's important to me to bring this knowledge to people all over the world as well. So please subscribe and give a like so that others can also join in and access this very valuable information.